Welcome to today's video. We're talking about anemia, one of the most common blood disorders in the world. Imagine a person who often feels unusually tired and weak. They become short of breath, even after climbing a few stairs. Their heart sometimes races, they complain of constant lethargy, and even experience frequent headaches. These symptoms make us suspect one important condition: anemia. So, what exactly is anemia? Anemia is defined as a reduction in the hemoglobin concentration of the blood, below the normal level for a person's age and sex. Now, what's considered normal? For healthy adult men, hemoglobin should be between 13.5 and 17.5 grams per deciliter. For women, the range is 11.5 to 15.5 grams per deciliter. If your levels drop below these numbers, you may be diagnosed with anemia. Doctors mostly classify anemia based on red blood cell indices, specifically MCV, or mean corpuscular volume, and MCH, or mean corpuscular hemoglobin. In microcytic hyperchromic anemia, the red blood cells are small and pale. Here, the MCV is less than 80 femtoliters, and the MCH is less than 27 picograms. In normocytic normochromic anemia, the red blood cells are normal in size and hemoglobin content, but reduced in number. The MCV here falls between 80 and 95 femtoliters. Finally, in macrocytic anemia, the red blood cells are larger than normal. The MCV is greater than 95 femtoliters, and the MCH is usually above 27 picograms. Now let's take a closer look at microcytic hyperchromic anemia. This type of anemia is often caused by iron deficiency, the most common cause worldwide, often due to poor diet, blood loss, or increased needs during pregnancy. Thalassemia, an inherited condition that affects hemoglobin production. Anemia of chronic disease. In some cases, long-term illnesses can affect how the body uses iron. Lead poisoning, which interferes with hemoglobin production, and sideroblastic anemia, where the body has iron but can't properly use it to make hemoglobin. Next, let's talk about normocytic normochromic anemia. In this type, the red blood cells look normal in size and color, but their numbers are reduced. Some common causes include hemolytic anemias, where red blood cells are destroyed faster than they can be replaced. Anemia of chronic disease. In some cases, long-term illnesses affect red cell production. Acute blood loss, such as from trauma or surgery. Kidney disease, because the kidneys normally make erythropoietin, a hormone that stimulates red blood cell production. Mixed deficiencies, where more than one nutrient deficiency occurs together. And bone marrow failure, which may follow chemotherapy or infiltration by cancers, preventing the marrow from making enough blood cells. Now, let's look at macrocytic anemia, where the red blood cells are larger than normal. It can be divided into two main types: megaloblastic macrocytic anemia, usually caused by vitamin B12 deficiency or folate deficiency, both of which are needed for DNA synthesis in red blood cells. Non-megaloblastic macrocytic anemia, which can result from alcoholism, liver disease, myelodysplasia, or aplastic anemia, where the bone marrow fails to produce enough cells. Thanks for watching, and don't forget to like, share, and subscribe for more health videos.